Okay, well, welcome to this presentation. I hope that you find it to be enjoyable. This is a topic that became, more and more interesting to me over time. I think you're really going to find this to be fairly illuminating. So, natural sleep aids versus prescription sleep aids, because you know that a lot of doctors write prescriptions for Ativan, like benzodiazepines and some of the shorter acting sleep aids that we'll look at. But the question is, how safe are they? And are there some natural things that can do as good a job, if not better, and actually provide some secondary benefits? And the reality is that that seems to be the case. So let's just talk about sleep and how much sleep people need. Most people need, adequate sleep, which is 6 to 8 hours per night. Without getting that, it's very much linked to the person's future health and well-being. We probably don't appreciate from day to day the importance of sleep to overall health. So we'll just review some of that. For most people, 7 to 8.5 hours is sort of the norm. Some people can get by on as little as 6, but those are the exceptions. Those are rare cases. Some people think that they can get by on 6, but actually their performance starts to decline. But you really should aim for at least 7 hours of sleep a night. Without adequate sleep, you're really asking for mental health issues, physical health problems, your quality of life changes, how you perform physically and mentally and interact with people really is very much determined by how much sleep you had the night before or the day before. So it really determines your quality of life, decision making, all kinds of things really factor in to sleep, physical and mental health aspects. And with sleep deficiency, you are setting yourself up for an increased risk of heart disease, kidney disease, high blood pressure, diabetes, and stroke, and increased risk of obesity. When people are tired, they tend to confuse fatigue with hunger. So late at night, some people, rather than going to sleep, they feel tired. They go to the cabinet and they eat a whole bag of cookies instead. So think about, your own nighttime behaviors when you're getting sleepy. Do you tend to overeat more carbs, eat more food beyond your feeling of contentment? I know that that's the case with me. So sleep deprivation also increases the tendency for mental errors, right? Traffic accidents, all kinds of tragic events. So sleep is critically important. And to help your patients get the right amount of sleep, I think is one of the factors that should come up in conversation. You can also get too much sleep. People who are sleeping 10 hours or more, there could be underlying issues here. They might actually be in a depression, or they develop diabetes, or they're at high risk for heart disease and their body is becoming extremely weak. There's a higher risk of death. People who are sleeping, this might exclude teenagers who can routinely sleep 10 to 12 hours at a time. But for a regular adult sleeping 10 or more hours a night, it requires a proper medical investigation with blood tests, ECGs, and so on. So just keep that in the back of your mind. In terms of what sleep is, there's 4 stages of sleep. There's these 3 stages that are sort of the non-rapid eye movement sleep, or non-REM, and then there's the final stage, the final stage of sleep, stage 4, which is REM sleep. So we'll sort of go through this, but generally the stage 1 only lasts for a few minutes. And it's when you're sort of asleep, but you're still awake at the same time, if you will. You're still sort of aware of your surroundings. Then you go into that stage 2 sleep, where your breathing slows down, your temperature declines, the brain starts to produce different kinds of wavelengths. It lasts for about 20 minutes. Then you go into a deeper level of sleep in stage 3, where you start to consolidate memory consolidation. If you learn something today, that's when it gets sort of stuck into your long-term memory and consolidated for the next day. So stage 3 is very important. Also, you get physical repair and renewal. Then you get into REM sleep, which is rapid eye movement sleep, where your eyes are moving quickly and you're dreaming vividly, but your body is absolutely paralyzed, so you can't act out your dreams. But this is also where your immune system is getting stronger and it's very reparative. So on the following slides, I have to move through these quickly because I have too many slides to present in 1 hour. I sort of summarized the different phases of sleep as I sort of quickly outlined it for you here. And you might find it interesting to go through. So I'll make sure these slides are sent to you after the webinar today, so you can actually drill down and just sort of appreciate the different stages of sleep. Here's sleep stage 1. It's sort of just, you're still sort of half awake in stage 1. Then sleep 2, this is 50% of your total sleep time is in non-rapid eye movement stage 2. And this is when your breathing slows, your body temperature drops down, and your body will revisit these stages throughout the night. Memory consolidation begins here as well, where you start to filter your memories and you consolidate things, and new skills develop. I know for myself, if I'm sitting with my guitar trying to learn a new guitar piece, and I work on it and I work on it, I'm sort of making progress. And then I sleep on it. And then the next day I wake up, and if I pick up my guitar very often, I can play it. Now I can play. The new neural circuit forms overnight while I'm sleeping. And that's how it is with memory and consolidating memory. That's why getting into these deeper levels of sleep becomes very important. This is stage 3, where your delta waves, this is a very deep level of sleep now, to the point where if there's noises in the background, they're probably not even going to wake you up. But again, your muscles are relaxed, your blood pressure is dropping, you're in a deeper level of sleep. Your body starts to repair itself physically. This is where physical repair starts to occur. Your body renews itself, and you consolidate declarative memories as well, new knowledge and stats and skills. And then you get into REM sleep, where the brain's really aroused and there's rapid eye movement, but your muscles are paralyzed, so you can't act out your dreams. It's a good thing that you can't actually start acting them out, because sometimes they're very vivid and crazy. So all 4 stages are critically important. And this one sort of kicks in about 90 minutes later. But it's stage 3 sleep and REM sleep where you get strong memory consolidation. So being able to get into deep sleep really matters. I'm really raising this issue because some people are now using sort of medical marijuana for sleep. But it actually allows you to be drowsy and to sleep, but it doesn't allow you to get into the deep levels of sleep that are actually renewing, reparative, and immune modulating. In fact, it weakens your immune system. So we're going to see this a little bit later on. So you want to be able to sleep in a way that gets you into all these stages. So your body goes through these cycles throughout the night, where you're going through the different cycles of sleep, and you repeat them a number of times throughout the night. And when you get into the deeper levels, your immune system's getting stronger, and all these things we sort of talked about. And once REM sleep is over, you go back to stage 2, because stage 2 occupies about 50% of all the sleep time that you have. So how do you optimize sleep? Well, many people are sleep deprived. They can't get a good night's sleep. 30% of Americans report not getting even 6 hours of sleep often. So a lot of things can impact it. Of course, stress. Your mind is very busy. Smoking, exposure to too much light at night, especially blue light. If there's any blue light in your bedroom, you want to try to cover that up. Certain types of modems and TV sets and clocks and things, sometimes they have a lot of blue lights. So you want to cover that at night. And also not getting enough light through the day, shift work, of course. And then as you get older, the drop in melatonin becomes a critical factor to not getting enough sleep. And current evidence, as they say, suggests that taking melatonin before bedtime may help. So this is from the Sleep Foundation. Also, recent studies on healthcare workers who are sort of frontline treating COVID-19 patients. The studies show that for every 1 hour of extra sleep they get a night, the risk of developing COVID-19 and its complications are 12% less. That's how important sleep is to a healthy immune system. So these people are at high risk, constantly in contact with people who are infected. If they get enough sleep, their risk is significantly lower. So this was just in 2020.
In these studies, the amount of sleep reported nightly averaged 7 hours, but was at least more than 6. But after accounting for other influential factors, every hour of sleep that one of the healthcare workers got was associated with a 12% lower odds risk of developing COVID-19 infection, and also decreasing the severity of infection in those who got some of these COVID-19 infections. And burnout seems to play the same role. Some of the healthcare workers who were reporting they were burned out. So this is when stress levels are very high, and very often there's some related insomnia problems with that. Their COVID-19 infection rates were also higher. So compared with those who didn't report any burnout, those for whom this was a daily occurrence were more than twice as likely to actually contract COVID-19. So it's been hypothesized that lack of sleep, sleep disorders, may adversely influence the immune system by increasing pro-inflammatory cytokines and histamines. So I think that's pretty well established now that if you don't get enough sleep, your immune system is definitely weaker. We've seen evidence like this before. And if the person also happens to be suffering from burnout, from just working exhaustive hours and being stressed constantly, we've known from other studies in the past that it heightens the risk of colds and flus and other long-term conditions like diabetes and cardiovascular disease, musculoskeletal problems, and even death from cancer. So your immune system is much weaker when you're overly taxed physically and mentally, or one or the other even. So the medical solution over the years, the pharmaceutical companies have developed sleeping medications, of course. You've seen, advertised, and many prescription drugs for different benzodiazepines like, Valium, Ativan, drugs like that, lorazepam. So 4% of adults take these, but 10% of Canadians over the age of 65 regularly take prescription sleeping medications for their insomnia and sleep disorders. So sleeping pill use increases with age, and so do things associated with it, like unsteadiness, falls, pneumonia, memory problems, unintentional overdoses when mixed with other medications, and dependence, and as well as withdrawal when people try to stop them. In the beginning, we didn't think that benzodiazepine drugs created addiction. It was thought that Valium was not an addictive drug, but it turns out that it actually is addictive, and there are withdrawal symptoms when people try to stop. So the study out of Dalhousie University showed that, in fact, sleeping pill use may account for up to 1/3 of all hip fractures in people over the age of 85. And that's because, when you're being drugged like this and there's this much sedation, that when you stand up to go to the washroom in the middle of the night, it's easy to fall down, hit your head, or fracture a hip. So sleeping medications are not risk-free. So in 2012 and in 2018, two very large, startling studies sort of hit the medical community in terms of published papers in these journals. So 2012 study, and I'll review the details a little bit later on, but the 2012 study showed a link between sleep aids to a higher risk of early death, right? Even if people were prescribed fewer than 18 pills a year, people prescribed the most hypnotics were 35% more likely to develop a new cancer after about 2.5 years of follow-up compared to non-users. So that's significant, and you're going to see this is a very large study. Then in 2018, a very similar finding concluded that sleep medications are related to serious illnesses and premature deaths from cancer, serious infections, especially upper respiratory tract infections, and also mood disorders, accidental injuries, and suicides, as well as homicides. So what are these drugs that we're talking about that could potentially have these side effects? Well, primarily they're the benzodiazepine drugs, and also these new Z drugs. These are non-benzodiazepines, but they work in a similar way. So benzodiazepine drugs, like Valium, Ativan, lorazepam, they're very good anti-anxiety drugs. They're good for decreasing seizure disorder in some cases. But when they're used as strictly a sleep aid, this is where I have some concerns because of the risks associated with their use, and also because they don't provide any health attributes the way many natural things do that we'll see down the road here. So those are the benzodiazepines. Then there's the non-benzodiazepines. This is a newer class of drugs. They're called the Z drugs, which are a little shorter acting, like just 4 or 5 hours. For someone who can't get to sleep and they're struggling, they might take it at 3 or 4 in the morning just to try to get 4 hours of sleep. It's sort of like a rescue medication. So these benzodiazepines and the non-benzodiazepines, actually what they do is they decrease the time it takes to fall asleep. They decrease the number of nightmare awakenings, and they increase total sleep time and sleep efficiency. They definitely help people get to sleep and stay asleep. There's no question that they're efficacious from that standpoint. These are the Z drugs like Ambien and Sonata. They're more short acting, just like sort of 4 hours at a time. Whereas a person who's taking Ativan might take it, before they go to sleep at night, say half an hour before or so. these drugs like Ambien and Sonata they're often used if a person tries to get to sleep on their own and they can't. And now they're still awake at 2 or 3 in the morning. They might take a short-acting drug like this just to get them to sleep, so they get some sleep and they wake up in the morning without some hangover type effect from it. The way that both of these classes of drugs work, the benzodiazepines and the non-benzodiazepines, is they're positively affecting gamma aminobutyric acid receptors, so the GABA receptors. So the GABA neurotransmitter is a very powerful inhibitory transmitter in the central nervous system. So it sedates things. It stops nervous transmission from being cranked up. So it really sedates things. So it can be used to decrease anxiety and to decrease, raise the seizure threshold. And it can also help people get into sleep. But there's some negative outcomes that can occur if people use these too often, including addiction potential. Sleeping aids, Z drugs like Ambien and Sonata. These effects, they're more short-acting drugs. These are drugs that people use. Let's say they go to sleep at 10 or 11 o'clock, and at 3 o'clock in the morning you're still awake. They can take a Z drug because it's shorter acting. It'll help them get maybe 4 hours of sleep. So they're sort of used as a rescue medication for sleep, if you will. They're not. Whereas the Ativan or benzodiazepine drugs, people use them at 8, 9, 10 o'clock at night to get into a deeper sleep. So the way that they work primarily is by stimulating the GABA receptors in the central nervous system, which I'm going to show you. The problem is that with the benzodiazepine drugs, and even these shorter acting Z drugs, there's strong evidence that they can cause addiction potential, so that if you stop using them, there are withdrawal symptoms. And that's a serious concern, as well as all of the other these other adverse side effects that I showed you earlier. So here's the GABA receptor in image form here. So normally at night, or when you're under stress, the body will produce gamma aminobutyric acid, the strongest inhibitory neurotransmitter in the central nervous system, and it'll attach to the GABA receptor, open the chloride channel. Chloride will go through and it'll sort of suppress nervous system nerve conduction and suppress the effects of adrenaline and noradrenaline. So it takes the edge off the day and you can sort of fall asleep or get into a more sedated state. So benzodiazepine drugs, and the non-benzodiazepine drugs, the shorter acting ones like Sonata and Ambien, they act on GABA receptors. And they have a similar effect as the natural neurotransmitter GABA. And of course, alcohol, if you drink enough of it, will actually be very sedative as well by acting on the GABA receptor. So as you have the nerve impulse traveling through the synaptic cleft, the benzodiazepines sort of stimulate the GABA receptor to amplify the GABA signal, which then sort of inhibits ongoing nerve conduction and suppresses nerve activity and sedates the person so they can fall asleep if they take a high enough dosage. And these are the Z drugs that I talked about earlier. They thought that they had less of a tendency to induce physical dependency and addiction, but in recent years that's been challenged. There's now evidence showing these things can also produce addiction, and a lot of North Americans use these drugs. So this is a 2012 study showing the dangers of these drugs with respect to mortality and cancer. So this is a study that included almost over 10,000 people using sleeping pills over a 2.5-year period, and there's 24,000 people roughly in the control group. So what they saw was that they showed that the 8 most commonly used hypnotic drugs they were associated with increased hazards of mortality and cancer, including the popular prescribed medications like Ambien, which is a short-acting drug, which we thought was pretty safe. So compared to non-users of sleeping pills, people using sleeping pills have these stronger associations with all-cause mortality and with cancer. The 2012 study here, going backwards, sorry. The study links sleep aid medications to a 4 to 6 times higher risk of death. Even among people who are prescribed just 1 to 18 sleeping pills per year, the risk of death was 3 to 6 times higher. And this was true for all age group, all age categories. Rates of new cancers were 35% higher among patients who were prescribed at least 130 hypnotic doses per year. So these are alarming statistics to me. So if you don't have to use these drugs for sleep, then I think the patient's way better off to use things that are more natural. So there are natural solutions to this. And of course, you know about melatonin, but I'm going to cover other ones here that maybe you're not as clear about. So I want to start with GABA. You can actually buy and use gamma aminobutyric acid as a supplement. That's what the GABA receptor recognizes to the greatest degree. But because it can't be patented, it's not made into a drug and there's no advertising for it. But if you take low dose GABA, it is a very powerful inhibitor of the central nervous system that's very much involved in sleep physiology. It's been shown in many animal studies to counter the wakefulness and insomnia problems induced by caffeine. So you give animals caffeine at a specific dose, it would normally keep them awake. If you give them GABA concurrently, it counters the effects of caffeine. And also in humans, we're seeing the same evidence. So reports suggest that GABA possesses other functional health benefits, showing potential effects on helping with blood pressure, decreasing stress, reducing risk of cancer and inflammatory disease. It has the opposite effects of the benzodiazepine drugs and the Z drugs. Studies suggest that GABA receptor agonists, or you're just using GABA itself, can alleviate sleep disturbance and help regulate circadian rhythm as it helps to regulate sleep. There's all kinds of great studies on this, also showing it has an inhibitory effect on this these excitatory new neuropeptides that had been discovered recently, the hypocretins. So you can review these slides when I send them to you. It also targets other independent pathways that are involved in sleep physiology, and we think it also helps to increase naturally. If you give people GABA, it also increases their melatonin and serotonin levels, which also secondarily help to improve sleep quality and duration. So the GABA studies are phenomenal. And then there's 5-hydroxytryptophan. Did I cover everything I want to say here? I think so. Then there's 5-hydroxytryptophan. So it occurs naturally. The reason it's not a drug is because it occurs naturally in this seed, this African seed. And 70% of the 5-HTP that you swallow, after it goes through the liver to be metabolized, the remaining amount of that, 70% of it crosses the blood-brain barrier and can be converted quickly into serotonin. So when you have higher levels of serotonin, you have a greater sense of well-being that can be helpful in preventing depression or as an adjunct to medications and treating depression, as we'll see later. But higher serotonin levels also help you relax and are related to sleep physiology. So 5-HTP has also been used in the treatment of fibromyalgia, insomnia, obviously, binge eating, attention deficit disorder, chronic headaches. Anytime raising serotonin levels can be helpful. The original studies on depression and 5-HTP were conducted in the 70s and 80s. Some of the studies were not conducted. They weren't great quality controlled studies. But generally speaking, in more recent years, we're seeing that 5-HTP can be used if it's monitored properly in conjunction with standard antidepressant medications. But that's another topic for another day. But just so you see the physiology, how the brain makes serotonin. So we see that tryptophan becomes 5-hydroxytryptophan. But if you give people 5-hydroxytryptophan as a sub, that gets into the brain much easier than does tryptophan. And it quickly becomes serotonin. And from serotonin, the pineal gland can make melatonin. Now, it makes less melatonin as you get older, just for genetic reasons. But it's been used in studies to improve depression. I think it may actually help prevent it as well. Crosses the blood-brain barrier extremely well. Rarely there are some side effects of 5-HTP. You see them here: nausea, vomiting, diarrhea. But really, as a rule, that doesn't happen if you use a low dose of 5-HTP. 5-HTP, those side effects occur when you give people 5-HTP as a single ingredient only, and you're giving them like 200 to 400 milligrams a day for, say, fibromyalgia. You might get side effects like this, but just as a sleep aid, you don't have to take doses that are that high. There's some precautionary notes with 5-HTP in people and children that have seizures or Down syndrome. Of course, women who are pregnant or breastfeeding shouldn't take anything other than what's prescribed by their doctor. Same with liver and kidney disease patients. 5-HTP may interact adversely with MAO inhibitors, but MAO inhibitors are not really used for depression anymore because they have so many side effects on their own. But it can be used in conjunction with standard antidepressant drugs, whether they are tricyclic antidepressants like amitriptyline or with Prozac and those sort of serotonin reuptake inhibitors. In patients who have Parkinson's disease who are on the drug Cardopa, which combines L-Dopa with a decarboxylase inhibitor. It's sort of a 2-in-1 type drug, so that more of the L-Dopa can reach the brain and become dopamine. There may be some interaction that might produce skin lesions in that case, so you want to be aware of that. But studies using 5-HTP for sleep are extremely encouraging, so showing the person gets to sleep faster, they sleep more deeply, which is great. And often these studies use high doses of 5-HTP as a single agent, but I'm suggesting that you don't do that because high dose 5-HTP can actually cause disturbances and side effects. So it's better to use low dose 5-HTP and combine it. So here you see the study below that I really want to get to, and that is that in these sort of caffeine challenge studies, we see that if you give animals GABA and 5-HTP together, you get an incredible effect on countering the effects of caffeine and helping to induce better sleep. So the conclusion in these studies was showing that through video tracking and behavior, that giving GABA with 5-HTP is a fantastic little combination. So the conclusion from this report in 2018 is that combining gamma aminobutyric acid and 5-HTP, just low dose, can be a potential medication that acts as a low dose with fewer side effects than common sleeping aids on behavior and neurochemical responses so that you have better quality sleep without risk of side effects. Also, when you raise serotonin levels, it can help people lose weight because when you have more serotonin, there's more satiety, you don't eat as much. And so you have less food intake, body mass index goes down. So there's a few studies like that. This takes us to melatonin, where I want to spend a fair bit of our time today. So you know that melatonin is normally secreted by the pineal gland. I showed you the physiology of how the body makes it. Normally, melatonin is made when the retinal receptors in your eye start to pick up darkness, and it relays a message back into the brain and stimulating the pineal gland to produce and secrete melatonin. So darkness is the stimulation. So it sets the circadian rhythm, the wake sleep cycles of most species on the planet is actually set by melatonin to a very large degree. So having that in the right sequence and set up properly is very important. But melatonin in the brain, where it's being secreted, is both a water-soluble and a fat-soluble antioxidant. So and remember, the brain is a very fatty, waxy area. So having an antioxidant in the brain that can work to protect the lipoproteins and the fatty acids and all the other fatty structures in the brain is critically important to us to preserving nerve cell function. We see that melatonin also modulates immune system function in a very positive way. It has a profound number of anti-cancer properties, which I will show you. I'm going to show you the evidence to show that helps to decrease risk of age-related neurodegenerative conditions, including Alzheimer's, Parkinson's disease, possibly Lou Gehrig's disease. And clinical studies show that it helps to reverse mild cognitive impairment, improving sleep in these patients and improving their cognition. Even people with early stage Alzheimer's disease, melatonin not only helps to improve sundowning, as you're going to see, where they get agitated later in the afternoon, but also improves their sleep quality and also their cognition in the earlier stages. In later stages of Alzheimer's, it's probably not going to be beneficial. And remember this, like serotonin and gamma aminobutyric acid, The brain really uses microgram doses of most neurotransmitters, including melatonin. So when you talk about epinephrine and dopamine and norepinephrine and melatonin, in the brain, these things are being released in very small microgram doses. So you don't need to take super high doses orally to be able to get microgram doses working in your brain. So here's the decline in melatonin as you age. So at the first drop off in melatonin actually triggers the onset of puberty. So this is where the discussion is around children. Do you give children melatonin if they have sleep problems? Well, if you give them too much melatonin, the risk is that it might actually impair the release of growth hormone and the sort of triggering into normal growth phase in around 12 or 13 years old. So that's still under review. But as you get older as an adult, your melatonin drops down. So it's harder to get into a deeper level of sleep and to get to sleep. But you're also losing the brain antioxidant properties. You're losing the immune modulation properties. You're losing the anti-cancer properties. You're losing the effects I'm going to show you in preventing neurodegenerative diseases. And you're asking for memory loss to occur. So this is where melatonin as a supplement can be just spectacular. So notice as it gets dark out at night, this is when your melatonin secretions are really starting to be naturally secreted in a normal sort of 24-hour cycle. And as you get older, there's less melatonin being secreted even late at night, even in the darkest possible room. So with respect to melatonin studies, the Sleep Foundation, basically their report says melatonin supplementation is really helpful for people who have what's called delayed sleep-wake phase disorder. So that would be me. I'm someone who's sort of a night owl. If left to my own devices, late at night I'll start getting tired. But then if a really good movie comes on, I'll watch it. Naturally, I would watch it till 2 or 3 in the morning, or I'll start playing my guitar at 11 o'clock, and next thing I know, it's like 2:30 or 3 o'clock in the morning, and I'm wide awake. So that's a problem. So I find that for me, if I take the melatonin supplement that I'm going to show you at around say 10 o'clock at night, that by 11 o'clock I'm ready to sleep. I can't watch a movie or start getting distracted by other things. So for people like me, it's extremely helpful. Also, there's great studies showing its effects on jet lag. So again, proven effects on people that have this sort of delayed sleep disorder as I do. And then you have jet lag, where you have very good studies showing that if you go to a new destination in a new time zone, what you do is you wait till you're at the point where you would go to sleep in the new time zone. Let's say you fly from Eastern time zone to the Pacific time zone. So you'd wait till you're about to go to sleep that night, say around 10 or 11 o'clock. You would take melatonin an hour before bedtime, Pacific time, and when you wake up in the morning, your body's circadian rhythm is now set to Pacific time. You don't have to wait the 3 to 5 days for your body to adjust. You can adjust it much faster by taking melatonin upon arrival just before you go to sleep that night. The studies with shift workers are inconclusive, but there's some pretty good evidence to show that if you're a shift worker, it makes sense to use melatonin to reset your sleep-wake cycles according to the shift that you're on. There are 19 really good studies that show the effects of melatonin just helping people get a better night's sleep, falling asleep sooner, better quality of sleep. So that in the year 2019, this incredible report by the British Association of Psychopharmacology said, based on evidence-based information that we have, treatment, melatonin should be the first choice treatment when a hypnotic is indicated in patients over the age of 55 years old. Not sleeping medications. Melatonin should be the very first go-to because it's extremely safe. For children, it can be effective, used over a short period of time to help reset their sleeping behavior, but used over a long period of time, the jury is still out as to whether or not that's safe. It should not. It may be especially useful in children who have epilepsy or autism spectrum disorder. This is where it might be, more beneficial for long-term use. But they have to clarify issues on this. And again, it may disrupt the body's natural neuroendocrine clock, disrupting normal growth. So that is a concern that I share as well. Surprisingly, melatonin supplementation has been shown there's some evidence to show that it may help to slow the progression of macular degeneration, which is the leading cause of blindness in people over the age of 55. So, and you don't need high doses, 3 milligrams a night. I mean, that's not a high dose. Also, for people with ulcers and heartburn, the combination of melatonin and 5-hydroxytryptophan has been shown to be useful for some of these patients. And for tinnitus, it's also for these patients that may help to tone down the ringing in their ears and help them get a better night's sleep. But just 3 milligrams of melatonin a night. You don't need high dose to get the microgram dose that the brain relies on. So normally when you're using melatonin, you would start at a low dose of like 0.5 milligrams and see how you do. And then if it doesn't really have an effect, then you would go up, you might go up to 1 milligram, then 1.5. You want to try to find the sweet spot where you're getting a good night's sleep without super vivid dreams that wake you up and without sort of a morning hangover. A lot of people start with 3 milligrams of melatonin and it's like, oh my goodness, it kept me awake. I had vivid dreams, and the next day I had a headache and I was really dragging. That's because the dose was too high. So you start low and you titrate up to the dose that works for the individual. There's some studies that show in adults that melatonin supplementation, even at low dose, can help to stimulate growth hormone release, because normally as you get older, your growth hormone drops and your lean mass gets catabolized. So there's a drop in growth hormone, after the age of 20, which, makes sense. You're not going to keep growing your muscles forever. Otherwise you end up like, Andre the Giant with acromegaly. But as melatonin as your growth hormone and your IGF-1 levels really decline later in life, that allows muscles to catabolize. So if you can just get a little bit of growth hormone being secreted as you get a little bit more than what you're seeing here, it can help to preserve your lean mass. The great thing about melatonin is it's safe, non-toxic, it's non-addictive. If you take too much, you might get dizzy, have a headache, feel nauseous, and have a hangover the next day. But if you take the right dose, that's very unlikely to happen. So now in 2001, we had the first indication that melatonin might actually help to prevent Alzheimer's disease. So in these sort of experimental studies, we know that people who have a particular type of apoprotein wrapped around their chylomicrons and their very low density lipoproteins, known as the ApoE type 4 subclass, have a higher predisposition to developing Alzheimer's disease. So in experimental studies, they showed that if they introduced melatonin into that environment where the ApoE4 was there, it actually prevented the buildup of beta amyloid plaque that's associated with the ApoE4 phenotype. Because we know in humans that have the ApoE4 phenotype, their risk of Alzheimer's is greater. So these experimental studies showed that melatonin could prevent the adverse events that occur in the ApoE4 phenotype by inhibiting the buildup of beta amyloid plaque, which is a signature aspect of Alzheimer's disease. Then we saw in recent years that melatonin supplementation could reverse mild cognitive people who are on their way to Alzheimer's disease or in the early stages of transition, giving them just 3 to 9 milligrams of melatonin a night over a 3-year period could improve their sleep and improve their cognition. So a number of studies have shown this. And so more recently, we're seeing studies using higher doses, 3 to 24 milligrams. Same effect in reversing mild cognitive impairment with really no side effects. And they're actually, this is not just subjective, this is, objective measurements of through mental examination showing better cognitive skills in people who are starting to lose their memory in the early stages. And they're getting a better night's sleep as well. No side effects. And decreased risk of depression in these patients as well. Better sleep quality, lower depression scores. It's remarkable stuff. So then in 2019, this great publication in Frontiers of Endocrinology saying, look, we have incredible evidence now from experimental studies and now early studies with Alzheimer's patients to show that melatonin prevents key steps in development of Alzheimer's disease and Parkinson's disease and can be used as a therapeutic agent are a complementary therapeutic agent in both Alzheimer's and Parkinson's disease in human studies. So it helps to prevent the buildup of beta amyloid plaque, and then it helps to remove any beta amyloid plaque that's been formed through what's called the lymphatic system. It removes those toxic products before they can build up and produce free radical damage. So in Alzheimer's studies, they use these transgenic mice. They're engineered to develop Alzheimer's disease. Giving them low-dose melatonin actually prevents the disease from developing by inhibiting the buildup of beta amyloid plaque. And it enhances the clearance of beta amyloid plaque, and it reduces brain inflammation in Alzheimer's models. And it's a very potent antioxidant in the brain. Melatonin is a more potent antioxidant in the brain than vitamin E or vitamin C. So in clinical studies with Alzheimer's patients who have this sundowning syndrome, where in the late afternoon they get agitated, they start wandering off, they become disorganized, they become more difficult to deal with, they have emotional disturbances, and they can't, their attention starts to really decline. Giving them melatonin at sort of before they sleep at night helps to keep their cycles more regular and decrease sundowning and improve their sleep and even improve their cognition to some degree. And the dose doesn't have to be that high. Other studies show that over a 2 to 3 year period, consistent results using 6 to 9 milligrams of melatonin in sundowning patients with Alzheimer's improved their cognitive performance as well as sleeping and decreasing the sundowning behaviors. Even in monozygotic twins, right? So identical twins who both have Alzheimer's disease, given one of the twin pairs melatonin and the other one not, the one that gets the melatonin, better sleep, better cognitive function. So these are gold standard type studies in human subjects. Of course, in fully developed Alzheimer's disease, you're probably not going to get a great effect from anything. And then again, this is just in 2019, they also commented on, mild cognitive impairment becoming dementia, sort of what is the yearly conversion from MCI to dementia. And that melatonin in the studies that I showed you earlier is very effective in helping to reverse mild cognitive impairment. So rather than the thing progressing, you're reversing it. So that's an incredible outcome to be able to demonstrate. Then in Parkinson's disease, most experiments support the role of melatonin in the prevention and also the complementary treatment of Parkinson's disease. Animal studies show that it complements administration of L-DOPA in Parkinson's treatment by quenching toxic compounds that can destroy the dopaminergic receptors, or neurons. So of course, in Parkinson's disease, the neurons producing dopamine and using dopamine are dying off. Melatonin may help to preserve their function and their longevity by preventing toxic agents from damaging those neurons that you often see in Parkinson's. It also improves sleep in Parkinson's patients, but melatonin doesn't improve the tremors or the decline in motor function. So let's be clear on that. Melatonin is not the answer by itself to Parkinson's disease, but it's a helpful complementary aid. But it may also decrease the synthesis of synuclein, which is responsible largely for the Lewy bodies that get created in the brain of many Parkinson's patients that lead to Parkinson's dementia. So that's the other application, is preventing dementia in the Parkinson's patients. Melatonin seems to play a role there. And also in this what's called rapid eye movement and sleep behavior disorder, which actually people tend to have as that precedes the development of Parkinson's disease. But Parkinson's patients often have it, where in their very deep REM sleep, they're acting out very violently and lots of shaking and moving about. And giving the melatonin helps to also tame that. But it may actually help prevent this RBD from occurring in patients who are maybe genetically prone to Parkinson's disease. That's why everyone, as they get older, I think, unless there's a reason why they can't use melatonin, should be on melatonin, even if they sleep okay, just for these other secondary preventative aspects. Melatonin, remarkably atoxic. Its safety is very high. In humans, melatonin has a high safety profile and is usually remarkably well tolerated. So it's just a great natural agent. And then in Lou Gehrig's disease, amyotrophic lateral sclerosis, you say, well, there's nothing you can do there, but evidence shows that The first thing that happens in Lou Gehrig's disease is that the ventral horn cells in the spinal cord start to die off. But before they do, the first thing that happens is their melatonin receptors disappear. And then that signals through signal transduction for the ventral horn cells, right? These motor neurons, they start dying in the spinal cord. And then, of course, the person becomes paralyzed. So experimental studies show that if you give animals who are genetically predisposed to Lou Gehrig's disease melatonin, that it stimulates the melatonin receptors to stay in place. The melatonin receptors don't undergo atrophy and die off, and the ventral horn cells don't die. They don't undergo apoptosis. And the melatonin also acts as an antioxidant, which is very important in the prevention of almost all neurodegenerative diseases, we think. And it stimulates the increase of other antioxidant enzymes like superoxide dismutase and catalase. So, in one clinical study in recent years, a woman who had ALS, they gave her 300 milligrams of melatonin using a suppository rectally, so you can get maximum absorption without and it bypasses the liver, so the liver's not breaking it down. When you put things in orally, of course, the blood goes things get absorbed in the bloodstream. They go through the liver, and the liver will detoxify a lot of things that you have, whether it's drugs or supplements. And so there's the remaining aspects that didn't get detoxified are available to be used by the target tissues. Using a suppository approach, you bypass the first pass through the liver, so more of the active agent can reach the target tissue like the brain. So that's why they did it this way. The results were astonishingly good, by the way, helping to slow the progression of the disease. So we even have at least one human case where this is valid. So as people get older, to prevent neurodegeneration, it looks to me like melatonin is a strong consideration. Then melatonin and immunity, I've shown you this in the immune section before, that melatonin, there's a docking agent right on the T helper cells, which is they're the quarterback of the whole immune system. When melatonin binds to the T helper cell or the CD4 cell, it really modulates immune system function in a significant way. In animal studies, giving older animals melatonin reverses the decline in immune function, and they have a more youthful immunity. And we think the same happens in humans, because I'll show you some of the human studies in a moment. So melatonin docks right onto this receptor on the CD4 cell. And then that really is the coordinates all the other immune cells to be working at a high level of efficiency. So as melatonin drops down as you get older, you're losing this modulation effect, and your immune system can never be as strong as it was when your melatonin levels were higher. And there's all kinds of research in recent years showing the impressive effects on melatonin on immune function in all kinds of human immune cells. So, and it shows you the mechanism of action through which they work on the antigen presenting cells, the CD4 cells, and even the natural killer cells, which are part of the innate immune system. The natural killer cells and the antigen presenting cells, they see a cancer cell or a virus or a bacteria, they just gobble it up right away before it gets a chance to have any traction. So as you get older, you're losing this effect. That's why as people get older, one of the reasons their immune system breaks down is they don't have enough melatonin to support it. So we saw this in COVID-19, where the National Institutes of Health on February the 3rd of 2021, this year, what did they say? Melatonin is another supplement that has been identified as a potential antiviral agent against COVID-19. It's been highlighted as a potential therapeutic agent, not prevention, but also therapeutic, due to its documented antioxidant, anti-apoptotic, immunomodulatory, and anti-inflammatory effects. So when Donald Trump was admitted to George Washington Hospital, part of the cocktail they gave him was melatonin, vitamin D, and zinc, because these things not only help to keep the immune system stronger on the preventative side, but have been shown to be beneficial, at least in early studies we have, therapeutically as well. And then melatonin in cancer. Not only does melatonin modulate the immune system, but it has some direct and indirect anti-cancer effects that are just eye-opening, really. So melatonin in breast cancer, there are lots of studies showing that low melatonin is linked to greater risk of breast cancer, and that melatonin has cancer-fighting abilities in breast cancer patients. Dr. Lissoni in Italy was the first one to use melatonin as a complementary agent in the treatment of breast and prostate cancer. You can look at that research and decide for yourself. Then in 2010, there was this fantastic review article showing the effects of melatonin on breast cancer, but it applies to other cancers as well, showing its effects. She lists them all. So actually, just so you understand, there are melatonin receptors on prostate cells and breast cells and other cells in the body, allowing melatonin to enter and modulate calmodulin, which you'll see is very important here, and also has direct binds to the retinoid receptor, goes right to the nucleus of the cell and gets the cell to slow down the rate at which it's dividing, increases the differentiation of the cell so it's more mature. It acts as an antioxidant, it detoxifies things, it helps to make sure that the cell is not going to act in an abnormal way that would make it more inclined to have cancerous behavior. So in this great review article on melatonin and breast cancer, she highlights all of these key factors where melatonin has been shown to play a role. Reducing overstimulation on breast cells of estrogen and progesterone by acting as a selective estrogen receptor modulator. So it's toning down the overstimulation of estrogen on these cells, decreasing the conversion of estrone, of androstenedione into estrone by inhibiting as an aromatase inhibitor. So you have less of the more dangerous estrogen floating around. It binds to the calmodulin, which I showed you in the previous slide. And when it does that, it helps to decrease the rate at which a cell is dividing. When cells divide too quickly, they make more genetic mistakes that can lead to cancer. It also helps to preserve adhesion molecules, so cells in the neighborhood are speaking to each other. So if one cell gets out of hand, the other cells can sort of congregate and send messages to the immune system to go and knock that cell out or get that cell to commit suicide. But cancer cells often decrease their adhesion molecules so they can hide in the neighborhood and reproduce, and the other cells don't know what's going on. Melatonin forces these cancerous looking cells to produce these adhesion molecules like E-cadherin and B1 integrin so that they can become targets for other cells in the neighborhood to generate instructions for apoptosis to occur or to get immune cells to come and knock them out. Also, it prevents the telomeres in cancer cells from lengthening themselves so they don't have this immortality. It inhibits the synthesis of certain fatty acids like the 13-HODE that you see here, which many cancer cells use for their own proliferation. So it's inhibiting that 15-lipoxygenase enzyme. Binding to the retinoid receptor, going right to the cell to have specific effects to make sure the cell doesn't act in a dysregulated way. Also, melatonin with immune modulation, we talked about that, suppressing inflammatory cytokines. These are unbelievable effects. So in breast cancer patients undergoing treatment, melatonin has been used to help them get a better night's sleep, better quality of life that they report, and maybe acting in certain ways in synergy with certain breast cancer drugs. So these are remarkable studies. And they're also showing less depression as well as they're going through treatment. So collectively in clinical trials, melatonin showed the ability to enhance the therapeutic effect of various anti-cancer drugs. That's amazing, while helping to get a better night's sleep and improving the quality of life of cancer patients. So these are human studies now. In prostate cancer, we have all kinds of evidence to show that melatonin does a number of things that can help to prevent the development of prostate cancer, the second leading cause of cancer death in men. So as your melatonin levels drop, as you get older, you're leaving your brain, breast tissue, and prostate tissue wide open to these effects that could have been prevented probably in many cases, these biological steps that are linked to the risk of cancer and neurodegeneration. Men who have lower morning levels of melatonin byproducts have been shown to be at higher risk for advanced prostate cancer in a number of studies. What we know is that melatonin slows down the rate at which prostate cells divide and increases their differentiation, so they're more mature, very similar to how vitamin D works, actually. Collectively, the scientific literature supports the potential application of melatonin in the prevention and treatment of prostate cancer. That's how I use it personally with patients. Even in these cases where prostate cancer is more aggressive, these sort of where you have androgen independent, where the prostate cancer cells don't have any androgen receptors, they're really malignant cells, highly malignant cells. Melatonin's been shown to tame even cells like this to some degree. Other cancers experimentally where melatonin shows promise in prevention of ovarian cancer, oral cavity cancer. These are important cancers. And also, endometrial, liver, renal, gastric, pancreas, there's this great, see this article at the bottom here, this reference at the bottom? This is really worth reading, published in 2017, showing all the anti-cancer properties of melatonin we've seen so far. Even in patients that have lung cancer, it's been shown to increase the therapeutic effects of radiotherapy and anti-cancer drugs in patients that already have lung cancer and being treated for it. So there's no question melatonin has these anti-cancer properties. How strong are they in the long run? There's a whole bunch of things that affect cancer risk. But for me, having adequate melatonin each day is one of the, I think, critical components of prevention that I feel is something to consider. I've used it personally. Then there's Bacopa monnieri, so it's also known as the water hyssop. In the Indian medical system, Bacopa monnieri is used to improve memory and reverse early stage memory loss. There's a lot of studies to show it can do that, but it's also a great brain antioxidant, and that's what I like about it in this application, is that with melatonin, it can help to maintain optimal brain antioxidant potential. Not a lot of antioxidants can cross into the brain very easily, but melatonin and the bacosides in Bacopa monnieri cross the blood-brain barrier and may even increase the synthesis of other antioxidants in the brain. Then there are these studies showing the efficacy of Bacopa monnieri in helping people who have early stage memory loss get their memory back. So as people get older, everybody could use some Bacopa monnieri to preserve memory and antioxidant protection in their brain. So you can go through these slides at your own pace, but it's just shockingly impressive the effect of Bacopa monnieri in acting as an antioxidant, reversing early stage memory loss. Part of how it's doing, increasing nerve transmission is part of it, but it also helps to maintain levels of acetylcholine, which is the brain memory chemical, as you likely know. So I like melatonin and Bacopa monnieri together after the age of 40 because I think it's getting this brain antioxidant factor is important. Also preventing biological steps linked to memory loss and other neurodegenerative conditions that we talked about, like beta amyloid plaque and these other factors. And it's very hard to get these antioxidants into the brain, like vitamin C and vitamin E. They don't cross the blood-brain barrier easily, but melatonin does, and the bacosides from Bacopa monnieri cross the blood-brain barrier very easily, and they work very well in the brain. What about cannabis? So this whole movement with marijuana and medical marijuana, this great 2017 review showed that particularly CBD has the potential to be a good treatment for insomnia and sleep problems. So does THC, but THC, unfortunately, decreases REM sleep. So, rapid eye movement sleep is, where you get into the deep levels of sleep, memory consolidation, and reparative immune system function and repairing the body physically. Well, THC may help you get to sleep and give drowsiness, but it prevents you from getting into deeper levels of sleep. So that's a concern. I'll show you some other concerns. There are some synthetic THC drugs out there that have shown benefit for short-term sleep. But CBD holds promise for REM sleep behavior disorder and excessive daytime sleepiness with synthetic THC may reduce nightmares associated with PTSD. So one of the places where CBD and THC show a lot of promise and used medically is for patients that have post-traumatic stress disorder. In this case, I'm all in favor of these people using marijuana because it's been shown to be helpful in those specific cases of sleep disorders related to nightmares, where they have flashbacks of what the trauma was. But again, it's all this research is still in the infancy stage. The problem I have with THC, which is the psychoactive part of marijuana that gives you the high, is that it reduces REM sleep. That's important. And so it's going to decrease memory processing and memory. So as you get older, the last thing you want is something else that's going to interfere with memory, the conversion of short-term memory to long-term memory. So a lot of doctors are recommending, these THC products to their older patients so they can sleep better as sort of a natural sleep aid. But it's problematic for a number of reasons. And one of them is that it actually prevents consolidation of memory. And on the other hand, too much REM sleep can also be a problem. And that's where these people with PTSD might benefit from THC. So every case is different. It has application for this particular subgroup of people with this particular sleeping disorder and behavioral challenge. So these are my problems with THC, right? So as nice as it is sort of a therapeutic high if you want to use it once in a while recreationally. Using it every day, it's going to interfere with your REM sleep. It produces tremendous lethargy the following days because it stays in your system for a long time, right? THC and CBD both, but are fat soluble. So some of it gets stored in your fat cells and it gets slowly re-released into your bloodstream over the next 10 days. Which, if in the case of THC, that can be problematic. In a roadside test where they check your saliva, your blood, several days later, when you're not really feeling high anymore from the THC, you can still test positive for THC in your system. So these are the legal issues that are trying to be resolved right now. But when you have THC in your system, it causes full body fatigue and unsteadiness because there are THC receptors in the cerebellum. And when they're stimulated with THC, you become very unsteady on your feet. So someone getting up in the middle of the night to go to the washroom was taking THC can easily fall down, hit their head, fracture a hip, and again, impeding memory consolidation. And THC and CBD both weaken the immune system. The last thing you want to be doing as you get older. So all of these factors come into play. So where you have medical application for THC that makes sense, it helps patients with multiple sclerosis. In my view, I've seen it work really well. PTSD, I think it's extremely worth trying. People that have appetite loss from chemo and radiation, and patients who have AIDS, it can help them get their appetite back. It decreases vomiting and nausea in cancer patients. A great application. It's being used as a sleep aid. I don't think it's the right sleep aid for most people. And possibly it may help with chronic pain, but CBD is much better than THC in that application. So CBD, which is the other active constituent in marijuana that's non-psychoactive, so there's no high or euphoria with CBD, but it does weaken the immune system. It can be useful for pain and as a sleep aid, but I must tell you, if you go and you buy CBD capsules, they're really expensive. Most people can't afford to be on CBD relative to the cost of melatonin, GABA, Bacopa, Monieri. When you put those things together in a supplement, a lot less expensive than just buying CBD. CBD is a fortune. So it has medical uses for seizures, in children with intractable seizure disorders. It's some absolutely miraculous results there. For some people, it helps them with their pain. For some people, it doesn't. It can be used as a sleep aid, but usually to work, you need to combine CBD with THC, and THC comes with a host of problems that I've shown you earlier. One other aspect of CBD that's impressive is that if it's in a topical lotion and there's a high enough dose, it can be very helpful for diabetic wounds. So there are great applications for these things, but it's on a case-by-case basis. Finally, there's valerian root. So valerian root is a natural agent. The National Institutes of Health in the United States say, it has some evidence to show that it's a sedative. It can be used to help treat insomnia. The evidence isn't really good. We're not sure of the mechanism of action. There's some adverse events that have been reported, but nothing that serious. What seems to happen is that things like the valerianic acid that's in valerian root seems to also increase the GABA neurotransmitter pathway, the same way that just taking GABA would do it. So I've seen people who have benefited from using valerian. But if you're using, there's this 2006 meta-analysis where they examined a whole bunch of studies And they said, there's some evidence that it improves sleep quality without producing side effects, but a lot of the evidence is a bit sketchy. But I have actually seen valerian root work. The thing is, if you're taking GABA as a supplement, then you don't need valerian root. They're basically doing the same thing. So it becomes redundant, really. So what I formulated a number of years ago that I use personally is this sort of gentle, non-toxic sleep aid with low dose melatonin, 5-hydroxytryptophan, like not at hundreds of milligrams. If you take 10 to 30 milligrams is all you need if you combine it with GABA and melatonin. And then I added the Bacopa monnieri to also act as a brain antioxidant and work on sort of memory preservation, if you will. So this is sort of these are the dosage considerations for it. At age 40 to 50, I think everyone, unless there's a reason why they can't take this, would take, one capsule, 60 to 90 minutes before bedtime. But then as your melatonin drops further, by the time you're 50, you probably need 2 capsules a day, 1 hour before bedtime. Sometimes 90 minutes before is even more beneficial. By the time you're 60 to 70, I still can just use 2 capsules a day. I'm in my 60s. But, often you might need 3 capsules a day to get the sleep you're looking for and wake up in the morning feeling good. After age 70, you need maybe 2 to 4. As your melatonin continues to decline, you're going to need higher levels to get the effects. The advantages of using a combination like this over Valium or other benzodiazepines or Z drugs, there's no risk of physical dependency. Doesn't increase your cancer risk. It probably decreases your cancer risk. It doesn't increase all-cause mortality or suicides or homicides. Brain antioxidant properties, really critical as you get older. Slows down the rate of cell division of breast and prostate cells, and has been used in cancer treatment. Preserves your immune system function, which is linked to cancer prevention and better immunity against infections. It can also support your serotonin levels. The 5-HTP does that for appetite suppression, mood elevation, helping people with weight loss. And then you get memory preservation, right? It's been shown melatonin reverses mild cognitive impairment. That's proven. And it seems, and there's very strong evidence to show that it blocks certain steps related to the development of Alzheimer's, Parkinson's, and Lou Gehrig's disease. So, benzodiazepine drugs aren't doing that. So this really should be the first go-to type of a sleep aid that people use, in my particular view. So that's my presentation for today. I hope you found it helpful. I'll make sure you get these slides so you can go through them a little bit slower at your own pace. Look up some of the scientific references to see if there's other things you want to read or confirm in your own mind. But to me, the evidence is quite striking that a natural agent like this combination is something that people should be using after the age of 40, even if they don't have sleep problems. Just the brain preventative effects, I think, are critically important.